Welcome back. I'm the Intensive D, a double board certified intensivist, here to give you an inside look into the intensive care unit. Today we're talking about 3 diseases that may put you in the intensive care unit that you may have never heard of. The first one is a pheochromocytoma. This is a neuroendocrine tumor. So this is a tumor that secretes or gives off epinephrine and norepinephrine, also known as adrenaline. It's typically found in the adrenal glands. The adrenal glands are small glands that sit on top of the kidneys. It gives off the adrenaline intermittently, so people will have episodic symptoms. So it'll happen for a period of time and then go away, and then happen again and then go away. So you imagine if something's giving off epinephrine, adrenaline, then symptoms could be sweating, having a high heart rate, feeling like your heart's racing because it's so fast, having a high blood pressure, which can cause headaches. And I remember learning in medical school that one of the hallmark signs is an impending sense of doom. And I thought, boy, I wonder if I have one of those. It was just my anxiety. These patients may come to the intensive care unit because their blood pressure gets very, very high and they need IV drips to control it to bring it back down to normal, because having a high blood pressure for a sustained period of time is dangerous. Like I said, this is a rare diagnosis, but we think about this in patients whose blood pressure seems to be up and down, all over the place, same with their heart rate. And we'll look at some urine tests to see if we have any evidence of what we call metanephrines. These are products given off by the breakdown of epinephrine and norepinephrine in the urine. And then if that's positive, we may do a CAT scan that's focused on the adrenal gland, since that is the most common place for these tumors to hide. So we'll do extra slices at the level of the adrenal glands to find this tumor. The treatment is prior to surgery. We treat them medically with heart rate, blood pressure control. And then obviously you want surgery to remove the tumor. And this surgery is typically done by a surgeon who specializes in these types of tumors, which we call neuroendocrine tumors. And you also need an anesthesiologist who is aware of what to look out for during the surgery, because this tumor, once you start poking at it and trying to get it out, the patient's blood pressure and heart rate can be all over the place, and the anesthesiologist needs to be at the top of their game watching this and making sure their blood pressure doesn't get too high or too low. I heard they love this procedure. Have I seen one of these during my career? I actually have seen a pheochromocytoma while I was in fellowship. The next diagnosis is something that's relatively new. It is first recognized or discovered in 2009, and it's called alpha-gal anaphylaxis, or red meat allergy. So anaphylaxis is a severe reaction to an allergy. It can be characterized as somebody feels like their throat's closing, their airways might become constricted, they get a high heart rate, they drop their blood pressure, which is anaphylactic shock. If you're in shock, your blood pressure drops. And they may feel like they're dizzy, they may pass out. So like I said, this is a food-induced allergy, and it's specific to red meat or meat from mammals. So the reason why this happens is actually very interesting. It starts with a tick bite. It's typically the Lone Star tick involved, and the tick will carry the alpha-gal molecule from an animal that it's previously bitten. So mammals have this in their blood. So if a tick bites the animal and takes up this alpha-gal molecule and then bites you and puts it in your bloodstream, then you've been exposed to it. Your body then recognizes this as a foreign molecule, so your immune system finds it and makes antibodies against it, so it knows the next time it sees it to kill it, because it thinks this is something that is not part of our body, it's bad, so we need to eliminate it. That's how our immune system works. So people who then go on and have a steak might have a reaction after having the steak because their body has previously recognized this molecule as bad. It's formed antibodies against it, so when they consume red meat that has this molecule in it, their body goes on to have this reaction, and it's a severe allergy. Like I said, this is something that is newly recognized. I'm not quite sure how they figured this out because it's a very interesting pathway, but I have personally never seen this specific allergy except on my board exams. The timing of the tick bite and the consumption of the meat, they haven't found a direct link to, how long after you are more or less likely to have this reaction. I've seen some scenarios where it can be weeks, months, years later, but they do say if you have less exposure to this, then your body, eventually becomes desensitized and you're able to have the products again. The last diagnosis is Vibrio vulnificus. This is a bacteria that lives in seafood. It's commonly associated with oysters and raw oyster bars. So the scenario would be somebody goes to a raw bar, has some oysters, and then gets sick afterwards. There's also scenarios where people are fishing and they get cut on a shell, and then they have the infection start from there. I have seen Vibrio in the intensive care unit, and I also read a case report where a surgeon had a cut on his finger, and this causes something we call necrotizing fasciitis. That is the flesh-eating bacteria, and it is a quick traveling infection. Usually with necrotizing fasciitis, you want a surgeon to come see this patient as soon as possible so they can take out the part of the soft tissue that is infected, because it can continue to travel if you get caught on your finger, travel up your arm, and it can be devastating. Typically, these patients, if they've ingested the oysters, they can have gastroenteritis, so an upset stomach, vomiting, but the patient that I saw had a cut, so he had redness, swelling at the site, and then he started forming these blisters. The blistering is one of the hallmarks of this disease. I'm gonna insert some photos here, so if you're squeamish, I would look away. So I'm just gonna put in the description a timestamp if you want to skip beyond the pictures. Like I said, these are some photos of the Vibrio. It can be impressive. So we diagnose this usually by, taking the medical history and hearing if they've had any possible exposure, if they have any risk factors, and cultures. They might grow it in their blood, grow it in the wound. And the treatment is antibiotics, but unfortunately also amputation. Like I said, a surgeon needs to act quickly to take the patient to the operating room and try to control the source of the infection, but many times people will lose fingers, hands, arms, toes, legs due to this to control the infection. If it's not under control very quickly, it can continue to worsen and cause septic shock, and the patient may die. People who are more susceptible to Vibrio are people who are immunocompromised, or particularly people with chronic liver disease. But I have seen Vibrio, and it was somebody who was perfectly healthy and had no history of liver disease at all. So if you want to hear 3 more things that can put you in the intensive care unit, let me know. I can do another one of these videos, because there are a lot of interesting things we see in the intensive care unit that may not be common knowledge. Otherwise, I'll be back on Tuesday with another video.